Hello, everyone, and welcome back to yet another session for our podcast series, Building Bridges, Not Walls, where we have been talking about and we will be talking about the topics that society just sweeps under the rug. And brace yourself because today we are going to talk about something very scandalous, controversial, and maybe just whispering about it in some places can actually get you into trouble. So, the topic is women's health and the mental well being associated around it. For starters, I think most of us are very well aware that half of the population is women, and half of the population bleeds. Half of the population is going through uncontrollable hormonal changes, and we all end up struggling and going through the phase of menopause as well. So, but at the same time, we just keep pretending that it's all just mystery, and we don't, and we should not talk about it. So, what we are going to do today, we are breaking the silence. We are busting myths. We are going to call out bullshit a bullshit. And we are going to spread some very informative, very helpful information as a mass awareness purpose with two of our expertise. So I am like very excited to have first female surgeon in our sessions, Dr. Shamail, who is a consultant obstetrician and gynecologist, FCPS Pakistan and MRCOG UK, with over 15 years of experience in the general OBGYN category. So I'm sure when she says something, it actually is true because she has been
Did,
dealing with all of that.
did she disconnect?
Yeah, I cannot hear her and her screen is
Oh
frozen.
dear. Oh dear. Might need to restart because hello, hello, hello.
Oh, I hope everyone can hear me.
Yeah, we can hear you. I think you disconnected in between.
I think there was a problem with my issue, but yeah, I'm going to continue with Dr. Shamail. She knows what's going on inside our body, so I'm sure if you are saying something, it's right because we have been dealing with all of the practical examples and specifically related to our culture, what's going on around with regarding with this specific aspect. And with Dr. Shamail, we have the famous Dr. Bilal, who's going to help everyone dealing with the mental war against everyone and anyone around us. And he's going to explain how all of these issues can actually have a mental impact in our general life overall. So, both of you, welcome aboard. And how are you two doing?
Oh, it's good. I'm glad that Dr. Shamal could join us. She's a very valued coworker, a very valuable part of the hospital where I work, and I'm just happy that she could make time. It means a lot that she could join us this evening.
How are you, Dr. Shamal?
Thank you so much, Hifsa and Bilal, for inviting me on this wonderful show. And I'm so glad that we brought up such an important topic, which people tend not to pay too much attention to. So thank you. Thank you.
I can't stop smiling because this is one of my favorite topics, and I would want to learn more about it, specifically regarding the miscommunication that I would have been hearing all my life, which are actually not true. Some of them are like I'm aware of now. But I'm going to start with the topic of periods, menstruation, or that time of the month. So, can you tell us what's right and what's wrong in that period? Like,
You
what's the
know,
most common thing and it is normal, let's say?
okay. So yes, so I'd like to say one thing, Hifsa. I
Okay.
don't know why. It's not even a national thing. It's like globally, we tend not to say the word period, and I don't know why. Just like you said, that time of the month. Why do we do
Because
that?
it's used as a joke, yeah.
Yeah, it's a
Yeah.
euphemism, right?
Yeah.
We avoid saying the word out loud, and it's just not just the men around us, but we women, consider
Absolutely.
talking about period. I mean, a bit. It's supposed to be concealed, like you cannot talk about it so openly. So I
Mm.
think it's about time we should normalize talking about period within the family as well. I've seen so many girls come to us, and they do not say it. They cannot say it in front of their husband or mother or sister, and we have to then ask the family to walk outside of the room, and then we can then they can open up to us. So I don't know.
Mm.
We'll have to. It's like a generational thing. People do not want to talk about periods. Girls do not want to talk about the problems that they're facing while they're on their periods. I think it's about time we should speak more openly about it and normalize talking about the issues women have during their period. It's not a disorder. It's not a physical
Mm.
or a mental disorder that we, should shame or stigmatize women for. Yeah. So
Mm.
that's something that needs to be, we need to talk more about it, and things need to change. Yeah. So I think that's about it. And so what? So I missed the beginning part of your question. If you could repeat that. You were talking about
It's like,
PCOS.
all of our lives. No, I'm talking about periods themselves. For
Okay.
example,
Yeah.
every woman has a different kind of cycle and different kind of mood shift. So, what is actually normal during how everyone experiences a few days in every month periods?
Yeah. So a period. So it's normal. We'd consider a period abnormal when the flow is too heavy. It's so heavy that it's affecting your daily, quality of life. If you have to take
Mm.
off days from work, then that's a period which is not normal, and you should see a doctor for that. I've seen girls and women come to me and tell me कि ये तो जी generational है, ये तो मेरी mother को भी था, ये मेरी खाला को भी था. So I've been told that it's normal, and I don't have to go to a doctor for that. And when they come to us, they're in such a bad shape. Their hemoglobin levels are low, their blood levels are low, they're emotionally and mentally wrecked. Um, and then
Mm.
that's the point when they usually come to a doctor. So any flow which is so heavy that it soils your clothes, you have to wear extra
Mm.
layers in order to um, protect yourself from soiling the clothes and everything. And then any period which is so painful that you have to take days off from work, you cannot function at home, you cannot do your daily chores, that needs to be seen by a doctor. You need to go and discuss it with your doctor. um yeah, so that's about it, and talking about the the hormonal changes while you're on your period. Of course it does affect your emotional well-being as well, but if it's again, quality of life is the most important thing. If you think that it's affecting the way you're living your daily life, then you have to go and discuss it with the doctor. It's not a bad thing. Maybe you have a normal period, maybe it's something that needs treatment. So, yeah.
Okay. And
So, one question from the man in the room. So, how do you decide if it's too painful or if it's not? Because obviously everyone has different pain thresholds.
yeah, I
So,
think Dr. Bilal recently had that artificial
yeah. I actually
sensation.
I was invited to another podcast about men's mental health issues, and at the end, I was asked to undergo a period pain simulator, which in and of itself was not only was it very fun, it was also very enlightening, also quite painful. Which is why I bring up the question of what's the metric we should be using for whether someone is just sensitive or if it's
There,
legitimately a medical concern.
the woman who will decide whether she can bear with the pain or not, and you don't have to bear with the pain. And it's the
Mm.
woman who will decide if she thinks while she's on her period she cannot function properly, then she has to
Mm.
see a doctor. So it will be different for different women, and that's when the doctor comes in. They'll assess you, and if everything was fine, they'll tell you, okay, you have to go to a talk therapist, you have to go to a psychologist, and they'll help you out with it. If there is
Mm.
something organically or physically wrong, maybe you have some hormone disturbances going on in your body, maybe there is something organically wrong with your womb or your ovaries, then
Mm.
of course that needs hormonal treatment. So it's the doctor who will decide whether you need any medical help for it, or whether you only need therapy or any
Mm.
psychological help for that. So
Right.
it's the woman there is no metric.
Mm,
You cannot
mm,
tell a woman kg jai, this is the score, and this is when you decide that you have to go
mm,
see a doctor. The minute you think, yes, I have a pain and I cannot get out of my bed, and I cannot go to my work, and it's getting the best of my
mm.
life, so you have to go and see the doctor. Uh, don't buy into people telling you, okay, ये तो होता है, you have to, just bear with it, एक दो दिन ही है, and then you can, go on with it.
Okay.
So just to add on to this, so I do have a question because I've had a fair few clients. I mean, I think they're more than they should be, where they've just been told that, oh, this is no big deal. Just go
Yeah,
talk to someone or
Mhm.
ठीक हो जाएगा.
yeah,
To
that's
which
the
and these
problem.
women are they're very clearly in discomfort, but at the same time, unfortunately, there was a bit of a distance that they were unable to communicate because I could not discern if they were genuinely in as much pain as they said or if they were just generally sensitive. Not that I would ever say that that's a bad thing, but it makes it a little difficult for me when I have to kind of engage with them because um, talking will not make physical pain go away. It's
Yeah,
there to teach you coping mechanisms, sure, but if you're physically in pain, nothing I say will make it better. You need an intervention,
Yeah.
right? Which is why this is something that I mean I might sound like I'm repeating myself, but I genuinely would like to know if at that point I should tell them, listen, you need to go to a female specialist, right? I can't help you here.
yeah. So,
So
is that, am I supposed to answer
yeah,
that,
go on.
right?
Yeah, no, no, go
Yeah.
on. Yes, please, 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 please.
Sorry, my internet is really bad. I've missed again a few, chunks of your question, but so that's you said it, you put it really nicely. That's the problem. We tend to dismiss the fact that not all period pain is normal, and like I
Mm,
said, I think Bilal would agree with me. So most of the girls or women would come to us before they go to a talk therapist. In Pakistan, we do not have that you know awareness that you need to go to a talk therapist, and then maybe he'll
That's
be the
not
person who will
true.
decide to go to a gynecologist or not. uh, so yeah, so when they come to us, again, we do not have any parameter which would tell a girl, yes, this is the point. I'll repeat myself. They need, if they think they're not well, they cannot do their daily activities normally, they'll have to come go to a doctor, and then
mm,
we'll assess them for any hormonal changes, any abnormalities in the womb or the ovaries, and then we think everything is fine. We'll of course put them on painkillers, but with that, the girl or the woman needs emotional support as well. For that, we can
makes
then
sense.
yeah, refer them
All
to.
right. Okay. That's helpful. That's helpful to know. Okay. Thank you.
I would like to add this thing like I can't even remember, can't recall, but since I have gotten them, there are so many things that I've been told I can't exercise. And when it comes to periods or anything related to reproductive matter, there is a religious element in a very a negative sense attached to it, that I'm completely impure. For example, I've
Yeah.
been always told I am impure and I am not like until that's over I can't call myself as a pure or clean person. So there are so many misconceptions, religious or non-religious, attached to it. I would want you to address and tell us that those misconceptions are actually not true.
Well, I'd love to talk about it because I've seen it happen in front of me in the clinic so many times. Um, yes, very truly so. It's not just the men, I'd say again, it's the women of the family, the elder women of the family as well, who say that if you are on your period, you're not supposed to touch the holy book. You're not
Mhm.
supposed to go to a place which is holy, like the mosque. And in some households, you're not allowed to even cook,
My
for the
god.
rest of the family. So yeah,
Really?
yeah,
Yeah.
that also happens.
Oh,
So
okay.
we need to talk more about it so that these misconceptions are addressed. I mean, it's unfortunate, Hifsa. And I don't know. I mean, I think the key to removing these stigmas associated with period is to talk more about it and discuss stuff. Uh, Truly, so it's of course a misconception. You're not unholy. You're not unpure. So we should stop using these words. You're on a period. It's a normal, physiological process the girl goes through. And I mean, I'm not a religious scholar, but even in the religion, if you're on your period, you can go for your pilgrimage as well, but you cannot perform Hajj or Umrah. I mean, you can be in that area. So,
Yeah, yeah.
of course, if it's allowed to do that,
Mm,
then
mm.
of course it's something which is a cultural thing, not a religious thing, and we've created it ourselves. So,
Yeah, yeah, yeah.
yeah, yeah.
Dr. Bilal, how
Yeah.
how how do we just, let go of that, I would say, shame or anxiety that is
So
attached with the word period?
So the thing is that one of the things that I insist on usually when it comes to talking about bodily autonomy, because that's what question is about. It's about bodily autonomy. Is that the more that you avoid something, the more of the stigma grows around it, right? I mean, for example, I'll use something from pop culture. If any of you have read the Harry Potter series, there's actually a part in the book where they say that not saying his name grants him more power.
Yeah,
You know, he who must not be named, right?
yeah,
And that's a very good analogy over here. That when you normalize the use of the word, eventually the stigma associated with it, and by extension the shame or the whatever dysfunction is associated with it, it will become normalized.
yeah,
So the idea is that, first of all, shame, the implication is that you have done something wrong and therefore you will be made to feel bad about it by external sources. That's the essence of shame. If it's internal, it's embarrassment. But if it's external, it's shame. Specifically with regards to female bodily autonomy, I have seen significantly more shame than embarrassment. Again, this is anecdotal on my side. I've seen more shame than embarrassment. So the idea is that I would be more concerned with having an open and frank conversation with the people perpetuating the shame rather than the girl or the lady herself. Because again, this is a biological necessity, right? This is not something we can change. It's gifted from nature or God or whatever term you want to use. This is going to happen,
and
right?
scientifically, to be very honest, it's actually healthy. It's
Yes.
it, like, if you're not getting it, then you should be worried about it.
Oh, absolutely. I mean, there's a reason why irregular periods are treated so seriously, because it is a necessity for the, reproductive and general health of the woman, right? So when we talk about getting rid of shame, the first thing I often ask is that, take it very seriously. You're not going to do that thing which young boys do, where it's just where you start giggling or you start smiling or you start looking
Yeah,
away. I mean,
I
it doesn't. Shame is not inherently verbal. It is actually more based in body language than anything else, because we are very sensitive to body language. So the thing is that, maintain eye contact, have that serious conversation, and if you find something amusing about it, well, that says something more about you than anyone else, right? So the idea is just have a conversation. Have a very serious, it doesn't even have to be a serious conversation. I'm not going to make a joke out of it, but at the very least, take it
talk about it.
seriously. Yes, if you can talk about urination, if you can talk about defecation, if you can talk about vomiting, all expelling bodily fluids, why should this be any different? Because it's blood? I mean, really, now that to me that's ridiculous, though.
Doesn't make
So
any.
no, it doesn't. So
Yeah.
there you go.
Dr. Ismail, you just brought up the word PCOS. I'll come to that. What is PCOS?
Mm,
What are the
mhm,
symptoms? How
mhm,
to know it is something that
mm,
we need to get it checked?
PCOS is basically polycystic ovarian syndrome,
Mm.
and it's an endocrine disorder, and unfortunately, it's growing in. I mean, we are seeing a lot of patients with PCOS. Um, the incidence globally is around 13%. In Pakistan, every 1 in 8 woman of reproductive age will be diagnosed with PCOS in her life. So,
Okay.
yeah.
mm,
So the thing is, Hifsa, PCOS sometimes is wrongly diagnosed. by the ultrasonologists. These days, we are seeing a lot of women telling us very casually that they have PCOS, but when they come to us in the clinic and we assess them, they are not actually PCOS. They have a condition called polycystic ovarian morphology. So any girl
Mm,
who's got a normal period and she does not have any hormonal abnormal changes in the body, like having a heavy hair growth on the face, thick hair growth on the face, weight gain, or acne. Uh, uh, they are not PCOS. They just have polycystic ovaries, and they're not labeled as having the syndrome. So
I
I,
think we don't even get the test done. If you're having
yeah.
those 2 to 3 symptoms, we automatically self-diagnose ourselves. Yeah.
I've seen so many girls come to me in the clinic, and majority of them do not have PCOS. Okay, so for a woman to have, the condition, she should first off have irregular periods, scanty periods.
mm,
Like she'll have
mm,
one period in 2 or 3 months' time, right?
Mhm.
Or she'll complain of, abnormal weight gain, and there's going to be this male pattern, baldness. She'll complain of excessive
mm,
hair loss, acne, and stuff like that, which shows that your male hormone basically is
mm,
a little. I mean, every girl has a bit of male hormone in their bodies, but if it's gets more than your female ones, the imbalance is off, then you will have all these symptoms. So if you have it on the ultrasound and you also have scanty periods, yes, then you have PCOS. If you have only PCOS on the ultrasound, PCOM on the ultrasound, and you do not have any cycle irregularities or you do not have any other hormonal imbalances going on, then you are not PCOS. You only have polycystic ovaries, and that doesn't mean,
Okay.
yeah.
Okay.
mm.
So syndrome is when you have the all the two or three features that I discussed, and that's
Okay,
when you need treatment.
so I got a
Sorry,
question
yeah,
actually because and forgive me if this seems a little basic. Is this hereditary? Because I usually see that there's usually a young girl will come to me, someone, teenager or above, and she'll mention in passing she has PCOS, and then casually, oh, my aunt has it, or my mother has it, or this person, and it seems rather common in the family in the family genealogy. Is that true? Is this genetic, or is
yeah.
this just
Mm.
coincidence?
Yes, yes. So it's mostly genetic. It runs in the family, and I think one of the reasons why it's more common these days is because we have more easy access to the ultrasound, and people can, if even if they have a slightest of pain in the tummy, they'll go and get a scan done, and the doctor would tell them that you have PCOS, PCOM.
Okay.
So yeah,
Okay.
it runs in the family, and it has got to do with your lifestyle as well. So the first thing that we tell girls with diagnosed with PCOS, the syndrome, is that you need to be more active. You should eat healthy. That's the first thing that we tell them. So you're very right. Yes, it runs in the family, and it mostly has to do with your lifestyle. If you are, not physically active and you're eating junk food all the
Okay.
time, which we do, so of course you'll be more likely to develop it. Yes.
Again, a bit of an odd question, but something which was said to me in clinic, which I found strange. One girl, she was very intelligent for her age, and she said that I blame my parents because they come from a long line of cousin marriages. That's why I have this. And for a minute, I was like, wait, does this actually have anything to do with that?
So see, so far we know that it does run in the family, but cousin marriages, I think would do not have. I mean, it doesn't have to do with you having to get more chance of developing
Okay,
later on
fair,
in your life.
so,
No, yeah, we do not have enough data to
fair enough.
support that.
There, I figured
Yeah.
there's no evidence to suggest that's contributing. All
Yes.
right, fair enough.
Yes.
Okay, because I didn't really didn't know how to tackle that, so I just kind of deflected for that one girl, which I was like, yeah, I'm the wrong person to ask about this. So,
But one more thing, that while if you're talking about this practice in Pakistan, if you're talking about PCOS, we can't exclude its impact or its relevancy with fertility impact and marriages. So I have seen women suffering, who are suffering or who are going through PCOS. They suffer through fertility, or they suffer through healthy marriages as well. How much is that true, specifically regarding fertility?
So, yeah, so it's true that if you have PCOS, it can affect your fertility, but not all of the women who have PCOS will have fertility issues. The good
Okay.
thing is that women with PCOS, if they have fertility issues, they're very responsive to treatment. If we compare the other causes of infertility, yeah.
Okay.
So, like you said, yes, Sifsa, a lot of young girls would come to me with their mothers pre-marriage, like before they're even planning to get married, with the concern that
Yeah.
okay, she has PCOS. What will she,
Hmm.
अब इसका निकाह हो गया, what am I going to tell her in-laws?
Hmm.
Should I tell them that she has PCOS or not?
Hmm.
So I tell them that see, it's a just like you have a thyroid issue, yeah. So you
Exactly.
Mm,
just
mm,
like like you have diabetes or a thyroid issue, all the endocrine problems.
Hmm.
Uh, I mean, there is no treatment for it. You treat the
Yep.
symptoms, right? Like just like
mm,
diabetes, if
mm,
you treat a patient with diabetes, you'll have to give them the treatment for the rest of their life, right? It doesn't go
Yep.
away. Yeah.
Yep.
mm.
And same goes for thyroid. So PCOS is the same thing. What I see is, unfortunately, girls, they switch doctors just to get a permanent remedy for the disease. uh, that doesn't
Correct.
happen. So this is the first thing I tell them. And then, of course, if you're getting into a marriage, it's a commitment. If you had diabetes or you had any other serious medical health condition, your partner is supposed to know. Not
Correct.
because it will affect your fertility in the future, but of course, you're living with that person. They, it's up to the patient to decide what to do. But I think it's a wiser way of going about it. So I just tell the family. I'm sure you'll ask Bilal as well. I don't know if this is the right way of doing it, but this is what I do. I just tell them, of course, PCOS. It's a lifelong thing.
I lost you.
No, no,
Today
no,
you're
no. She'll be
coming in
back.
with your mother. Tomorrow
She'll be
you'll have
back.
a
Um,
partner.
oh dear. Oh dear.
Right. Dr.
Hang on.
Bilal.
Hang on. Hang on. Oh, yeah. Okay. While she comes back. Sure.
Yeah. So I do have one question to ask, because I have seen girls, if they are going through, like if they have this condition of PCOS, they do have high self-esteem issues.
Oh
They,
yeah.
yeah.
Oh yeah.
So how do we cater that specific element which becomes a part of your personality actually?
So the thing is that when it comes to PCOS, the first step is to address what they think it changes in their identity.
Hmm.
I mean, I'm glad that Dr. Shmal, she mentioned diabetes, because the thing is that a lot of people, they somehow internalize the diagnosis as their entire persona.
Hmm.
That, oh, I am diabetes now. Young girls are especially prone to internalizing PCOS as an identity feature,
Hmm.
mostly because they are made to, again, the shame component. They're made to feel like there's something wrong with them,
Yeah, yeah.
right? That there's you are tainted, you are changed, you are not normal. Very very sweeping, grand, generalized statements, right?
Hmm.
All which contribute to identity problems. Now, the first thing is that, okay, first of all, this is not a visible disability or anything like that. At worst, you can have a few hormonal issues. You'll get acne. You'll have a little bit of a hair problem. You'll have maybe your period will get a little irregular. These are all things that can easily be resolved with, well, grooming, for instance. I mean, you can just spend a bit more time on how you self groom, not really as catastrophic as people think. And secondly, when it comes to the period itself, you have professionals who are there to help you. I mean, I've had clients who said straight up that, oh, we won't take birth control, but we don't know what other options. I was like, well, then go to your specialist,
Hmm.
right? Do not treat this like a death sentence. It's not. And something I want to add on for what Dr. Shamal said. The reason why I have found that so many families are reluctant to disclose about PCOS is it because it gives the other side an excuse to terminate the marriage.
it's going to ruin their
It's an
relationship.
excuse. It has no bearing in rational thought. But again, the misconception that, oh my God, she's tainted, she's not normal, she's unhealthy, it'll affect the health of the children, and all kinds of rubbish, all completely unfounded rubbish. But again, I mean, when it comes to, I mean, as you both obviously know, marriage is very serious business in South Asia, right? It's a very serious business. So the thing is, nothing that can jeopardize it will be brought up, um, until much later down the line, or ideally never. But in less than ideal cases, oh, by the way, it's nothing serious, just PCOS, nothing to worry about. And then it just casts a shadow on the union going forward because what else have you? So it's a mess all around either way. Which is why, again, I often recommend that look, if you have any health complications, just save both of yourselves a lot of trouble and just disclose from the start. Or if you want to be really proactive about it, just ask the other person during the courting phase. Just, do you have any illnesses? Because look, not that I would behoove anyone for this, but you should know if the other person's family has cancer in it, right? Cancer is very serious business. It causes all kinds of complications and strain. PCOS is, it's pebbles by comparison. It is very easily managed by comparison, and it's something that does not, on the grand scale of things, affect the marriage as grandly as, say, cancer, right? But again, to go back to what we've been saying earlier, if you don't talk about it, the taboo gains power, right? So we have to talk about it. Hello, hello. Ah, there we are.
Okay.
Mhm. So there we
I
go.
can hear you. Yeah. Okay.
Yeah. All
Um,
right.
Dr. Shumail, I'll move towards the more controversial part of today's session, the reproductive health itself. So, in our country, in our region, broadly speaking, women do not have the right over their own body autonomy. So, whether I talk about contraceptions or miscarriages or ending of pregnancy in one way or the other, or just the idea of having the right over yourself, it's such a big cultural stigma that it has completely shattered the whole idea itself, what it represents.
Mm.
So I would want your opinion that how it actually work when we talk about contraceptives, what methods are there, why do we not talk about it like not just the it's not just the body autonomy itself, it's about your when you talk about family planning, you don't take care of your own mental health, you don't take care of your financial stability, you don't take care of your physical health. It's like an obligation. If you have gotten married, this is what you have to do as a next task. What about it?
Yeah. So, since I work in Pakistan, Hitsa, I can only tell you what happens around here. It very truly so. We do. So in Pakistan, unfortunately, the access, it's not easy to access birth control methods, unfortunately. And I think the system that has to be blamed for it, and partly the gynecologist, the hierarchy of the gynecologists that we have as well. Um, so unfortunately, we do not easily have access to the best, one of the best ways of birth control, which is IUCDs. You would be alarmed to know that in the last 3 or 4 months, we could not get simple copper IUDs for patients. So we had to call different vendors personally to request them to get it, or import it from places which weren't authorized, and we had a lot of questions about their credibility as well. So yeah, so that's serious. That's something which is very serious. 4 months we had no IUCDs, and we could not offer that to patients. The only options that we were left with were combined pills. So there are different options
Mm.
that we can offer, and then you have to see which patient would be suitable for which method of birth control. So unfortunately here, it's not, the access is we need to make it more accessible to women. And the fact that people do not talk about it, see, it has to be, this is something which needs to be talked about before a woman or a girl gets married. And
True.
I'm seeing a little improvement on that, because some of the couples are, and when I see them, I'm so happy to, discuss this. I see couples to me and discuss that they want to, plan their family 2 or 3 years after their marriage, and how it should be done. Um,
Mm.
on the contrary, access to medicines which
No,
ends
no, 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 no,
pregnancy
no,
are
not
more
when it was getting
accessible in
exciting.
Pakistan.
There we are.
Yeah. So that's again something
Uh-huh.
which is,
I hope
very, very,
she
very
comes back
unfortunate.
soon.
Um,
No, no, no,
I
no, no. It
think
was getting
we have
exciting. Come
a
on.
big, big role to play in this.
Okay.
There is a family planning organization in Pakistan, and I
I have a
think
feeling that
we've
it
been
will
over the
show up,
past few years, we've been,
uh,
you know, uh,
but it's something that can't be
trying
sorted
to.
out with editing.
Oh, she's
Oh,
back.
there we are. Oh, there you are. You're back. You're back.
Sorry, my internet
Yeah,
signals.
there was a
Yeah,
internet issue.
Unfortunately,
yeah,
you kind of zoned out just when it was getting exciting. You're excited when couples show up, and
yeah, yeah. And so, yeah, I'm excited when the couples show up and discuss about birth control openly. And I'm so happy they come in
mm,
with their partners rather than with their mothers and khalas and pupos,
Oh,
who scare
mm,
about birth control. We have a very negative, impression on all the different types of birth control methods that we have. It's so
mm,
ironic when when I talk about birth control to the women or girls. They'd ask me question, नहीं नहीं इससे तो मेरी खाला को ये हो गया था, उससे मेरी फूफो को
hmm.
ये हो गया था, और फिर बहुत मसले हुए थे. And then I ask them, see, if you end up in an unplanned pregnancy, you're happy with going to different unlicensed, shady
Practitioners.
places,
mm,
quacks, and you get these medicines to end the pregnancy, and it's very dangerous for most of them. It
Yeah.
affects your mental health, your physical health, and then it can affect your future fertility as well. So why not
mm,
go for a method which is safe, and the doctor is advising you how to take it? If you have any problems with a certain kind of method, you can always switch to another one.
mm.
So yeah, so that's something which needs changing. We need to, put up more awareness videos regarding, this thing, that of course the birth control methods are more safe than taking medicines, because medicines, HIPSA, which and pregnancy are easily available over the counter these days. I've seen patients come to me who've taken dozens and dozens of those medicines, and then they come to
Good
me and
God.
say, "तो हमने ले लिया, अब हम क्या करें?" So then I tell them, अब हम कुछ नहीं कर
Uh,
सकते, अब आपने just इंतजार
So
करना है. Unfortunately, in
isn't it
Pakistan, we do not
ironic that
have a law in place which guides the medical practitioners like in the West. They tell you that you
mm,
can, offer a safe ending of the pregnancy procedures to these patients. But we
yeah,
do
yeah.
not have that in Pakistan. And I think there's a reason for that as well. Bilal would agree, because the religious scholars would jump in. And
Oh, I was coming to that.
well, see, the problem, unfortunately, is to go back. I mean, religious scholars notwithstanding, we go back to the same root cause, which is female bodily autonomy. Because unfortunately, there's the social clout behind it now. Because we're talking controversial. Unfortunately, if the Women's March, their slogan, unfortunately, has been so ruined because it's being misinterpreted on so many fronts. What was it Meri Jism Meri Mercy? I think my body,
That's
my
always the
will.
yeah,
most
just a
controversial
moment.
one.
Yeah.
Yeah, it's
So
always.
so so the thing is that my body, my choice. That's how it was when I was abroad. My body, my choice. It made it very clear what the intention behind it was. Unfortunately, over here, because of local semantics, language structure, etc., and the social implication, it's turned into something very sleazy,
Hmm.
or at least that's what a lot of naysayers would like for it to be turned into. You see, but the problem is again because the religious component loves to interfere with things and then bully the other side into submission. right? Because unfortunately, there's no way that you can challenge religious dogma without being accused of blasphemy.
Always misinterpreted as well. So if I would talk about, let's say, family planning, people
Mhm.
would always use the sentence के हर बंदा हर बच्चा अपना risk लेके आता है, but where is the
No,
common
no,
sense?
no,
Can
no, no,
you
no, no,
afford
no.
that बच्चा?
In a vacuum, these are great. In a vacuum, and forgive me, Shmuel, just give me 1 second. In a vacuum, these statements are great, but practically speaking, we're living in a country which is facing an overpopulation crisis,
Exactly. Yeah.
among other things, right? The problem, and to go off into economic theory, every child that is born is a burden on the economy. And we're living in a country where 4 children plus is the norm, at least in non-urbanized areas. In the urban areas, it's less than 3. But in non-urban areas, it's 4 plus, right? And those are going to be their burden on your economy. We're not a welfare economy, right? And then you wonder about all the crime, about the begging circles, about all these other criminal activities taking place, right? It's great to say that to comfort someone who's going through it, but realistically speaking, that does more harm than good. That it does so much more harm than good ever could come out of it,
Yeah. Yeah.
right? But go ahead, Shmuel. I'm sorry.
No, I completely agree with you, Bilal. We are unfortunately a nation who do not plan ahead. So
Mm,
it holds true for the fact that, I'm not fine with taking birth control because it's going to cause weight gain and it's going to affect my future fertility, and I'll have acne, I'll have this and that. But we're fine with taking medicines in dosages which are not recommended and which can cause a lot of health negative consequences on your reproductive health even in the future.
Hmm.
You're fine with that, but you're not fine with taking the birth control
Yeah.
methods that are available. The thing is, are the, you know we, the, unfortunately the government is also not very keen on making these birth control methods available in Pakistan. We're having a very
But
hard time, Hifsa, fixing, trying to find the different methods that a patient would want to have for them. I've had a very hard time in the past few months
but
because I
but
don't
I
know for
find
some
it
reason.
like when it comes to medical science, I find it very ironic. Like you yourself said that there are medicines over the counter available to end the pregnancy,
Yeah.
let's say. So
Yes.
mm,
people take it
mm,
in their own hands.
mm.
Why are the preventive measures are not available via the proper practitioner who has the license to do that? Who has, like, why the birth control is not in access, rather ending the pregnancy you can just go to the pharmacy and take it.
See, so you cannot have a legal, um,
Precedent, I think, is the word you want.
yeah, because the clerics would jump in, like I said, or they'll make
Yeah.
it very hard for the parliament to pass a
but
legislative
but
measure.
but birth control shouldn't come into that category. I
Birth
understand the other
control,
part.
Oh,
yeah,
sweetheart, you have no idea. You have no idea. Birth control is serious business. I think,
very.
Shema, you might remember. You might remember when it was COVID, how many people at the hospital refused to get the vaccine because it would affect their fertility, allegedly.
I still
Allegedly.
I still see patients. Even yesterday, I had a patient who said to me, जब से मैंने वैक्सीन लगाई है, जो है
Yeah,
मैं
there we go.
कंसीव नहीं कर पा रही हूँ या मेरे पीरियड्स खराब
There
हो
you
गए.
go.
Yeah.
There you go. There you go. I had, and I'm not joking. To either of you. I had practicing, administrative staff who work with surgeons, who work with myself, psychiatry, etc. All of us, and to my face, with zero sarcasm, told me, "Oh, I'm not going to take the vaccine. It's going to affect my fertility, and my husband really wants a son." This was after 3 daughters. And I was just like, oh, great. So you work in medicine, you've seen all the test results, you've seen the research data, and you're telling me this with a complete straight face. Unfortunately, I could not respect that person anymore after that conversation as a practitioner. So and this is what we have to work with. So when we talk about saying that, when you ask Hifsa that why can't medical practitioners provide these tools, because let's call them what they are, they're tools. It's because the tool is going to be used as a metaphor for everything that is wrong with education and medicine.
Yeah, yeah.
I'm not joking when I say that. It is going to be used as a metaphor of the corruption that by extension we would be spreading, because now you're going to be able to, because Lord knows the clerics absolutely hate this, you can now have risk-free sex, right? You can actually have sex for pleasure now, which is something which is just completely abhorrent to the nature of what it's designed for, according to that narrative, right?
Yeah, yeah.
So that's the problem over there.
But
Also, we have
I have
Sharia law in place, and there is some. I mean, there is just one line about abortion law in Pakistan. I'm using the word because it's by the name of abortion law. So,
Sure.
and the one liner that they have is very vague. Like they we do not have anything in place for the medical practitioners to make it safe for a person to decide whether you, even if a patient comes to us who has a abnormal baby, you need to have an opinion from another doctor, um, from two gynecologists to say that okay, this pregnancy should be terminated. um, yeah, you need
Dr. Shamail, I always had this question regarding, like, you were talking about the like medical science is advanced enough to like pre-identify it. But what about the, like, I maybe it would be very controversial to say, but what about the rape victims? Why do
Mm.
they have to go through certain things which they were not a part of consensually?
Oh boy. Yeah,
I
that's
would not
oh
want to
boy.
go to that conversation here, but like I
Bilal.
always had this question, there should be
No,
some.
because I've had cases like this. I've
Yeah,
had
Bilal.
cases like this. Yeah, yeah, yeah. No, no. I've had, look, I mean, the amount of women who come to me and who will not even disclose that they've been assaulted, I have to figure it out on my own with zero guidance, right? And unfortunately, I've gone to a point where I'm very good at it. And when I explore with them and I tell them, look, let's please let me introduce you to someone who will then do the checkup to see if you're all right, right? And they will often just devolve into this spiral, into this catastrophic spiral of shame, guilt, and self blame, right? And then again, if we, I mean, I don't like saying this, but usually the perpetrator is someone that they're involved with, or if it's not someone they're involved with, it's someone in the family, right? The statistics, both internationally and otherwise, have proven that rape is rarely committed by strangers, rarely. And the thing is that if it's someone you know and they've sexually assaulted you, the girl will be victimized because what were you doing with him? Why were you with him alone? Or if it's someone else in the family, the question will immediately there'll be a question of no, they couldn't do it, right? I mean, and we're not talking just rape; we're talking sexual assault as a whole, right? So, and it's always someone in the vicinity, right? Thankfully, I have never encountered a case where the survivor, rather, I should say, was impregnated, successfully impregnated. I've never had that kind of case. But if I was put in that position as her mental health professional, the only thing I would say to her is that you didn't choose this. You can choose to eliminate as well, right? Because I cannot imagine that, even on a religious level, that there's any divine entity that would say that no, you have to carry this unwilling child of assault to term. I cannot envisage any kind of divinity that would encourage that. But then again, like Shmuel very correctly said for herself, I will say the same thing. I am not a religious scholar. I will never pretend to be a religious scholar. I'm going to apply my both my medical knowledge as well as my own moral compass over here, right?
Rape is
Actually
a
just
very
painful to
sensitive
think about.
subject, and like Bilal said, I've never seen a patient who has been a rape victim and has come in with pregnancy. But it's very important for us to emphasize on the fact that all the rape victims should be, encouraged. Most of them do not
Mm.
report to the
Oh
to
yeah,
the
oh yeah, yeah.
do not go to the doctors. So it's very important because a part of their physical examination when they go for the medico legal is that we offer them birth control methods like emergency birth control methods that would prevent them from having a pregnancy. And then I mean, if they do end up in a pregnancy, we again do not have any law in place In the West, they do,
Mm-hmm.
but over here, we do not, unfortunately, have any law in place which can guide a medical practitioner to, you know, follow that.
Well, let's put it. Let me take it one step further. There's nothing I can do if I've been told that someone has been sexually assaulted. Were I abroad, I can still report it, even if the victim is unwilling. I still would be required to report it in some context. Over here, if I try doing that, the only question I would get asked is, "Who are you? And what authority do you have to report?" Because in my head, if I try doing that, I know my client is so traumatized that she would either outright deny that that happened in the first place, and I am made into a liar as a result. I lose all credibility. And on the other hand, then and I don't blame her for this. She would go around saying he betrayed my medical confidence, my confidentiality. And again, I'm proven a liar, right? So the thing is that I am not even empowered to try and help them or intervene for them on their behalf as someone who is the custodian of their mental health in a professional level. I am not allowed to intervene either, right? And yes, there are requirements abroad to be able to do that as well, but over here, the only thing I can really say is, do you want to talk about it? I mean, that's all I can do. And it's so disempowering to know to learn so much when you're abroad, to be told, here's the system, this is what you can do, go to him, go to her. And then we come here, and for you too, Shamal, I mean, imagine it's just as frustrating that all you can really say is, well, here you go, here's some pills, and I hope you feel better. It's so disempowering and so disappointing on our side, considering how much time we spend learning on how to make people get better. I find it terribly disempowering at this point. So,
It's discouraging for women
Totally.
because most of them do not go and seek help because they know that our legal system is just going to drain them,
mm,
dry of
yeah,
cash.
yeah,
Yeah,
They
yeah,
would,
yeah.
yeah, end of the
yeah.
day, they're just going to be left with a lot of shame and nothing else, unfortunately so. But
And debt, shame and debt.
yeah, it's very important for them to go to a health, practitioner because I keep on saying it's very important. It's very difficult to, spread that kind of awareness to people. So giving them medicines to prevent pregnancy, along with that, we also give them medicines as a prophylaxis to prevent them from having serious
Mm.
transmitted infections as well. So it's not just that;
Oh
it's
yeah, oh yeah.
serious infections like HIV, hepatitis B and C, which can be transmitted
Yeah, yeah,
to glucose. So it's very important for them to have these vaccinations and treatment. Uh, you know, if they are unfortunately rape victims. I mean, that's one thing that.
Dr. Shumail, I'll come back to the topic. We detract from the idea of misconceptions about fertility issues, let's say. But apart from the misconceptions, fertility issues, they do exist. There can be many reasons for that, health reasons, and even majority of the time, even in a partnership, men are responsible for that as well, knowingly
30%.
or unknowingly. So I would want your opinion on that specific area, because there would be so many women who are just unaware of why they are having a certain issue, what they can do about it, if it is treatable or not. So I'm sure in your experience you would have seen a lot of such cases, and I would want your opinion on the actual legitimate fertility issues that are existing and the medical science which has developed so far in order to solve it.
So, over here we see patients who would come and seek for fertility treatment 2 or 3 months after they get married. Uh, yeah, because of
That's a
the
joke,
social.
by the way.
It's when
Seriously, 2 3 months?
you see women like that, it's like uh, I
Oh
it's
wow, okay.
intimidating. But
But I won't blame the girl into that, because
no,
again,
no,
as
no,
you
they're
said,
not
there has been
forced.
no discussion before marriage. There
Yeah.
has been no discussion between the partners
Yeah.
itself. It's like the mother-in-law and the mother or the sisters. They are taking
Yes,
care of the whole thing.
that's very. So when we see them, I think most of the gynecologists would agree with me. They do not even come with their partners. They'd come with their
Yeah,
mother-in-laws
yeah,
Mm.
or
yeah,
their
Right.
mother. majority of them with mother-in-laws, and some of them would come with their mothers. And basically, these women who they come with are the ones who are more concerned than them, actually.
Yeah, a
Yeah.
true story.
So
Yeah.
see, when do a couple need investigations or fertility treatment? It's when they've been living together for at least 2 years and they've tried for having a baby and they've failed. So 2 years. But over here
Mm.
we see them after a few months when they try and they fail, and then all of the family goes on and tell them to go and seek help. So
Mm.
2 years, if the girl has been having regular periods, regular period is an indication that you're having normal ovulatory cycles, and you need not to worry about anything. And 90% of the couples would conceive without any treatment in the first 2 years of their marriage or
So
living together.
one thing I would add on, which sounds very basic, but you'd be surprised how underestimated it is. I have found so many couples who, I mean, obviously they've pursued, intervention from a female specialist, but they come to my door and they're usually like, "Oh yeah, we're not able to conceive." And my first question is some variation of how stressed out is one or both of you, because it is extremely difficult to conceive when one of you is stressed out, let alone both of you. I mean, even in the animal kingdom, you will notice that animals which are stressed out do not typically have any kind of reproductive cycle. It's the same with humans. We're very sensitive to stress. So the thing is that, again, even, I mean, we'll take the 2 years. If both of you are struggling financially, if both of you are struggling with your studies, like your PhDs or your whatevers, or if you're struggling with social dysfunction, yeah, no, that doesn't mean there's something wrong with you. It just
Yeah.
means you need to learn how to relax, take a break, get out of here, go to a different city, get a hotel room, something like that. It makes a world of difference. But it's so misunderstood because people just casually sidestep. I have stress. It's fine. It's normal.
Yeah.
No, 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 dude. It's not really. No, it's not normal. It's really not
How
normal.
many patients, Bilal, have you seen in the clinic who have been referred to you by a gynecologist who've been on
Far too
fertility?
many. Far too
Okay.
many for my liking, because the problem is usually, I mean, I'll give you an example. I do have someone who I've been told is suspected ED and has been very specifically told no psychiatry medication whatsoever. So that pretty much explains what his referral is all about. But the thing is that, I mean, I know we're talking
Yeah.
about women's mental health, but even with men, I am shocked as to what lengths they will go to avoid talking about their problem, when talking about it will actually give them the appropriate information necessary to address it once and for all.
That's
I
again
mean,
another stick.
Yeah. So they wouldn't even come. So whenever a couple, it's very important for the couple to come in if they're seeking for
yeah,
fertility treatment. So whenever I see a family member coming in with the patient, I always tell them we'll meet another time, but I need to see your husband as well. Yeah. And then when they come, they
oh come
first want the woman to
on,
be
the
investigated कि भाई
cliffhangers.
इसका सब कुछ ठीक आएगा तो फिर मैं
But they're
कराऊंगा
having,
टेस्ट,
I
which is
can make
also
literally
very wrong.
dozens of memes
So
out of
you're,
it because
yeah, yeah,
Oh, hey, you're back.
because
Ah, she's
say
gone.
something. Sorry.
Oh, you're back.
welcome back. Hmm.
Hi.
Oh dear.
Yeah.
So yeah, we were left on the cliffhanger again. You get really excited when a couple comes in and
It's at the right time, the wrong time, most wrong time, but the right time.
oh dear.
Anyway,
It's hey
Dr.
Shmal, you
Shah,
back?
can
You
you hear
back?
us?
Yeah. Yes.
Hello, hello. Oh dear, the internet's really, really taken an offense to this conversation. No,
I want one very
I'm so
serious thing
sorry,
to
guys.
know
Can
about
you hear me?
if she's back.
no, I'm sure we can figure this out. We'll
Yeah, she's back, I guess.
be back. No,
I'm so
No, no,
sorry.
no,
no.
no, no. That's all right. Happens to the best of us. Not in your control. It
Changed
happens.
the room
Oh, okay.
where I'm sitting.
So yes, you were saying you're very excited when the couple comes in.
Yeah, so it's very important for the couple to come in because you're the people who are actually you're the ones who want to have a baby. Yeah. So, and it's very
Mm.
important for the husband to take the test at the same time as the wife does, because most of the husbands would say, get the woman tested first. If she's fine, then I'll get my tests done. Yeah.
Yeah.
Or they would
Yeah,
say
yeah,
that,
पहले उससे गड़बड़
huh,
निकला है फिर मैं देखूंगा.
yeah,
exactly. Yeah. Because
yeah.
deep down they're afraid if something, that if the test reports would say something which is against my
Hmm.
thing, that the it affects,
Changes their
it's
masculinity.
yeah, yeah, then there's going to be a stigma, and
They come out emasculated. Yeah, the
it's
word you want. They're
yeah,
emasculated. Yeah. So
yeah.
fun times.
So,
Oh
So
well.
Dr.
that's one
Shmail,
thing which is very important. And like Hipsa said, over 30% of the cases, are the male. There's a male factor which prevents a couple from having
children.
infertility issues. So the two things which
Mhm.
are very important, and I wanted to address them, is that you need to go with your partner, with your husband, to the clinic, and the husband needs investigations at the same time as you do, and you should at least try for 2 years before you go and waste your money and your time, and if it's going to have a very negative effect on your mental health as well. I've seen couples who conceived 6 or 7 years after they were offered IVF and IUIs, and that all of that failed, and they
Mhm.
just you know lost
Which
hope.
itself is
Like
an
Bilal said,
emotional
the
toll.
couples would just give up hope, and when
Mhm.
when you give up hope, there's no, you're less stressed. You see, couples think,
Mhm.
okay, ठीक है, नहीं हो रहा तो नहीं हो रहा, maybe नहीं होगा, और वो हो जाता है without any treatment.
Mhm.
I've seen so many couples
Mhm.
who were given a verdict by the doctors, the treatment has failed, maybe you would not be able to, even conceive with IVF, and they've conceived without any treatment. So, yeah, that's one thing. Stress
Dr.
is a major
Shmail,
factor in fertility.
Mhm.
uh, before I wrap up the session, there is one very important topic that I wanted to discuss, because even if I, as a woman, I'm talking about myself, up till to a certain age, I did not know the concept of it, if it existed, or what does it mean and how does it happen. Menopause. So, like, not even for the men or the women, literally, not anyone in the domestic household would understand that it is actually a very legitimate end of the like women reproductive cycle that every woman has to go through, and there are certain changes, whether they are emotional or physical, that happens in their body, in their mind. So I would want to know about menopause and its impact on your physical body and on your mental health, and I'll come to you, Dr. Bilal, how to cater it. But yeah, Dr. Shumai, please enlighten about the menopause, because I don't know if women, when they're going through, their partner wouldn't know anything about it if their
Yeah,
partner is going
so
through menopause.
menopause basically is when your periods have stopped for more than a year.
Mhm.
That's when you're considered to have hit the menopause milestone.
Yes.
But menopause से 10 years पहले, so the 10 years preceding when you hit menopause, you're labeled as perimenopausal. So your hormones, the hormone imbalance starts happening. So if the average age in Pakistan for a woman would have menopause is between 50 to 52 years. And
Okay.
so if you subtract 10 years, so 40 years ke baad se you'll have symptoms of, perimenopause.
Mhm.
And that would include mood swings, it would include um, sleep disorders, it would also include having some, maybe you've heard of symptoms like hot flushes and night
Mhm.
sweat, all of these
Mhm.
things. And um, for all the most of the gynecological issues, again, there is no parameter in which we would gauge, okay, this is the person who needs to go and seek help. If you think, okay, the mood disturbances that you're going through while you're in the perimenopausal phase, they're affecting your daily work, you need to see a doctor, because then maybe we'll consider giving you hormonal replacement therapies. um, Again, it's very important to know that so you must have we again dismiss a lot of women and say कि जी ये तो she's menopausal तो ये तो mood swings तो होंगे maybe I'm menopausal तो ये मुझे हो रहा है just dismiss the fact कि वो आपके पूरे दिन की पूरी आपकी लाइफ एक्टिविटीज को वो इफेक्ट कर रहा है सो important to
Mm.
see a physician it's important so the two or three things um, I'll quickly just tell you that bone health is very important so once you hit menopause you menopause is when 1 year के बाद आपका पीरियड बिल्कुल खत्म है so 1 year में आपको बिल्कुल periods नहीं हुए you need to take care of your bones so you have to be on calcium and vitamin D diet you have to be physically active you should gain muscle uh,
Mm.
strength. You should do
Muscle mass. Yeah.
yeah muscle mass, and you should do strengthening exercises in order to gain
Mm.
muscle mass. And then of course being physically active because once you hit menopause you're more likely to get cardiovascular issues so you need to be physically active take care, get a a cholesterol level done and if it's not within the range you should go to see a gynecologist or a cardio physician who would guide you what to do maybe you'd need medicines for that and of course your diet so you need to and I mean, have a healthy lifestyle. You should eat healthy and be physically more
Mm.
active when you hit menopause.
Mm.
And we should not
Mm.
dismiss women who have symptoms and just tell them कि बस 1-2 साल की बात है and you'll be fine after that. और या फिर
Mm.
mood issues उनको होते हैं so we should not tell them कि जी तो menopausal है so she's just acting up and she doesn't need to seek any help for it.
That must be
Mm.
painful though, hearing just this
Yeah.
as a
It's quite
Mm.
reason.
unfortunate. I've seen some of my relatives say that maybe I'm just menopausal. जो मुझे ये, I'm just tearful
It's
because I'm
like
menopausal. Yeah, yeah. So
Yeah, throw it away. Just like, oh, I'm kind of OCD, teehee, or I'm just kind of depressed. It loses all meaning if the way you abuse it that way.
but Dr.
So,
Bilal,
yeah.
what's the emotional toll that it takes when you're going through menopause? Because I got to realize it way after I experienced women going through it, but I didn't know what
Mm.
they're going through it. How do you deal with the emotional toll? Because they do see a lot of major changes in their body, in their mind, in their personality, their like, dislike, their craving
Yeah.
changes. How to cater those changes by being well
S-
aware?
So the thing is that awareness only goes so far because knowing something is going to happen, it does not compare to the experience of it actually happening, right? So the thing is that I mean, again, this is a personal preference. It's not really a clinical requirement, but I usually will try and have them go through the stages of grief as best as they can because it will feel like they've lost something. It does.
Yeah.
You're transitioning from one state of your life into the next. And the thing is that the same way that little girls when they have their first period, the way they're treated is so wildly different from the way they were before they had their period. This is very similar in the way that a woman is treated when she is premenopausal or even menopausal than the way she would when she wasn't.
Hmm.
Because the thing is that she has lost something. She has lost whether she will or will not want children is irrelevant, but she has now reached that point where having them has become an active difficulty. You have lost something, something that a large part of your life was revolving around. So I try and walk them through the grief that yes, you should be angry, you should feel sad, you should feel depressed, you should feel like you're going through something tough, but all these changes are in service of something bigger than yourself. They're in service of the fact that you are living your life. Right now, you have entered a new stage, which means that you can. I don't think the word recreate. That's the wrong word. But you can essentially evolve into another version of yourself, the way that we should as we grow older. I mean, no one in their 50s is going to be expected to behave the way they did in their 20s.
True.
The same way that, again, for women, they should be welcome to this stage. That look, you assuming that they're a mother, of course, that you have successfully reached the stage where you are now a senior parent, right? You should be happy. You've lived long enough to see your children grow older, and basically recontextualize is what I'm saying, right? But the grief component is very, very, very real. Unfortunately, a lot of women overlook that and they just get dismissed as, oh, you're just being moody, or are you depressed, or go to a psychiatrist, or all these kinds of deflections which are laced with a little bit of condescension, right?
Yeah, it's not only overlooked, it's like even if they say it out loud, it would, they again, the condescending part, and it's everyone is going to just undermine their pain or undermine the situation they're in.
They won't even recognize it.
Yeah.
That's it. Let alone undermine it. You have to, if you undermine something, you have to recognize it exists, right? So that's why I often spend more time than I should,
Mm.
just sort of inviting them to feel the pain so that the pain can leave them.
Yeah.
Because otherwise they sort of get very irritable and cranky and snappy,
Mm.
right? Which again, the stereotype of the menopausal woman who turns into a screaming banshee, right? That stereotype, that's not fair.
Yeah.
That's not fair. She's going through something physically, let alone emotionally. So don't turn it into a stereotype, right?
Too many questions, too little time. Dr. Shamail, as a practiced, licensed healthcare practitionist, and I would also would want to acknowledge here because it's not easy what you do. It's like
Mm,
dealing with
mm,
such grave situations where are so many, legalities and
Oh, I think
religious and
Bilal's help
non-religious
every now
component
and
involved.
then.
It can't be easy, so acknowledgement is there. But I would like to have one last opinion or a message to out of this session from your side, so that I can, like, after that I'll wrap up.
Well, thank you so much. I really loved talking about stuff which we do not talk about so openly. Um, so yeah, it's mostly it's like we have to again normalize talking about these things. Period is not a disorder. Should not be taken as a something which is unholy, and it's basically you have to conceal everything related to your is reproductive health from your family. Like, yeah, so we need to have more talk on it, and make people more aware of the fact that it's okay to talk about period related issues to your doctors. Anything maybe it's not something serious, but it's okay to go to a specialist and talk about all the concerns that you have about your reproductive health. It's more commonly, I'm so happy to see young girls coming up these days to me in the clinic and saying that, yeah, we need
mm,
to seek help and we need to talk about birth control methods and stuff like that. So awareness is something which has to be spread by us and by all the social media people who are more active on the social media to spread awareness regarding all these things. So yeah, and I think we have to talk more about it in order
Thank you.
to remove the stigma around it.
Yes. Do- Dr. Bilal, the same
yes.
question from you.
Oof. Well, I'm not by no means anywhere near as well versed in this as Dr. Shmail is, but what little I've observed in my own practice is that, look, what's real is real. You know, considering my entire practice is based on what people think is real. This nobody thinks the period is a myth or thinks that it's an abstraction. It exists. We know it exists. And if you know something exists, there is no benefit to anyone by trying to shy away and hide it, or whatever narrative agenda there is around it. It's real, it exists, it's there, and it's affecting half. I mean, technically speaking, I think there's more women than there are men in the world now. It's affecting more than half of the population on a real time, everyday basis. I think it's ridiculous how this is not something which is just openly talked about to the point where it's common for children to be aware
Yeah.
of, right? Because again, I mean, why not?
Mm.
What harm is there in talking about this? Like I said, urination is normal, throwing up is normal, defecation is normal. Any kind of expulsion of bodily fluid is made normal. Why isn't this one made normal? Because of the tangential affiliation with with sex and child what's it called, reproduction,
Mm.
right? That's it. You take that component away, no one would have any issue with it,
True.
right? So, and the thing is that again, the more you talk about it, the more empowered everyone is, not just the women. Men especially need to know about this too. I've talked about this in previous episodes. I've talked about in clinic. I think I even talked about this with you at one point, Shmile, that men come in and they're like, I don't know what to do when my wife is on her period.
Yeah.
Have an emergency care package, a warm blanket, her favorite snacks, her favorite TV show, and just comfort her.
Well, it
It's not
doesn't
worth.
sound like a bare minimum, it sounds like a luxury.
See, there you go. There you go. Because if you know that the care package is expected, then really, I mean, you have no excuse,
Hmm.
right? But again, like you said, a lot of women report it as a luxury. So, which I find tragic. And that I think encapsulates my entire opinion about this whole matter. It's tragic how much of it is misunderstood and is actively, misunderstood. People are trying to misunderstand. So I think it's just
Small
tragic. That's
things
that,
which happen,
and
like,
I'll leave it at that.
yeah, small things like, you go to medical store and you're buying your sanitary products,
Mm,
you have to wrap it up in a brown paper. We do not wrap
Oh my
yeah,
diapers
yeah,
up.
God.
yeah.
Why do
Oh
you have to
God.
do that?
Yeah, yeah, yeah. The inconspicuous brown baggie.
Why is it
Yeah,
a shame?
I mean,
there you go.
when they
Yeah.
offer me a brown paper, I just get so angry. Why would you do that? But that's what happens, and we
Focus
need.
more on sustainability and saving the paper rather than putting the pads in
Yeah,
the
yeah,
paper.
yeah,
But
It's
yeah.
ridiculous all around.
yeah.
It is. But yeah, there you go.
Anyway, quite a conversation. I thoroughly enjoyed it, although I still want to discuss it more. But then again, I would also say that women health or reproductive health, it's not a mystery. It's as real as it can get.
Yeah.
And, talking about it is not going to cause any earthquake. Like it's very famous, so it's not
Oh
going to
yeah.
cause any disaster. The
Mhm.
more we talk about, the more we normalize talking about it,
Yes,
the more it is going to become healthier for men, women, and even children. So
yes,
all of the human beings together. Yeah. So having shower during periods is not going to make you sick. Rather,
mhm,
you should take more shower and feel clean.
true. It is very
Having PCOS and talking about it is not going to cause any problems in your healthy marriage,
Hmm.
and many other misconceptions associated with it. So yeah, thank you so much for both of you joining and putting in with the sheer audacity of talking about everything that's forbidden, and everyone else who actually listen and stick to the conversation again what we were having. Thank you so much. And if you think that you can relate or anyone you know who can relate, share this episode with them, especially to those aunties and uncles who are going to put Jahannam ka fatwa. So yeah, please share this episode with them. Um, please be kind to each other, to yourself, spread kindness, and yeah, help out each other. And until next episode, build bridges, not walls, and let's shatter all the stereotypes, all the taboos together. Until the next episode, thank you so much. Bye bye.